To our health correspondent, Nicola Hill, who joins us now live from London. Good to see you, Nicola. So how have doctors changed the way they see patients, particularly cancer patients?
Well, as you say, Maria, they really have had to change the whole treatment paradigm of these patients because they don't want to submit them to any extra dangers with coming into contact with COVID-19. And as we know, many cancer patients have been told to shield at home and to not leave the home. However, I've been speaking to a professor of oncology from here in the UK, and she says that cancer patients shouldn't worry too much because they can still treat them, but they're having to do it in a different way. So she's saying, for example, patients are driving to the car parks of the hospitals. They've created here in the UK cancer hubs, and it's something that's spreading across the world because general hospitals have turned over their cancer wards to COVID-19 patients. So the cancer patients are being told to drive to the car park. They're then tested to see if they're COVID-19 positive, and they are treating every patient as suspected positive person. If they are COVID-19 negative and they need surgery, they can still have it. So different operating theatres are being kept particularly clean for cancer patients who need their tumours removed. And I was told that one surgeon apparently sort of said that he'd managed to operate on 6 patients that day. Now, normally they'll do 12 in a morning. The reason it's taking so much longer is because they are wearing full PPE. And as you can imagine, with the visors, with the gloves they're wearing, manipulating the small instruments they have to use in surgery is much more difficult. And they're deep cleaning theatres in between each patient. So it's taking longer, but it is going on. If a patient needs radiotherapy, they're being told to walk themselves into the unit. They have the radiotherapy and they walk themselves out, so they don't actually see anybody. And if they're on chemotherapy, and this is the big issue because, as you just said, that does lower the immune system, doctors are looking at alternatives, and this isn't just here in the UK. The European Society of Medical Oncology has had has had articles printed from various oncologists, cancer specialists around the world and around Europe, where they're looking at swapping treatments, maybe giving hormone therapy or immunotherapy instead, particularly any drugs that can be given orally by mouth, so they don't need intravenous injections. And patients can take a chemo holiday, so they can have a gap between the chemotherapy. It's what patients normally do when they go on holiday. So that is a possibility, and it's something that's being considered. The other thing that the professor told me this morning that's a bit more grim, she treats lung cancer patients and she is having to have those conversations with them. She says it's highly unlikely lung cancer patients would be put on a ventilator if they got COVID-19 because they've already got a compromised respiratory system. So it is the conversation about, do you want to go into hospital? Where do you want to die?
Very, very sad to hear that. Nicola, very briefly, surely there are people who don't want to go to a hospital and are just full of fear with the mere idea of even driving up to that car park, being tested there, or even just the thought right now of approaching a hospital.
Very much so, Maria. And it's not just people with cancer. The European Society of Cardiology sent me a press release this morning saying that the numbers of people with heart attacks and strokes have dropped dramatically. Now, they don't think that the actual numbers of heart attacks have stopped, but they just think, unfortunately, a lot of people, as you said, don't want to go to hospital. They don't want to overburden a stretched health system, or they're terrified of getting COVID-19. Now, the president of the ESC is saying, you know, if you've got symptoms of a heart attack or stroke, you still need medical help because delaying it can kill you. It can cause heart failure and it can severely damage your heart. So she's saying you still need to seek help if you need it. And that's in America, that's in Australia, that's worldwide. These specialists are saying that they're appealing to people. If you need help, if you need medical attention, still ask for it.
Okay. Nicola, we'll leave it there. Thank you very much indeed. Nicola Hill from London.